Welcome to LECOM Health Matters. Our guest today is our good friend, Jason Turba, a pharmacist with LECOM Health. And Jason, welcome.
Thank you.
To get started, to get the dates out early, and we'll come back to them at the end. We have a big flu clinic coming up. So if you can first start by telling us when and where.
Okay, yes, this is our annual flu vaccination kickoff event. It's being held on September 3rd from 8 a.m. to 5 p.m. at the Zemzem Shrine Club on the corner of 38th and Zuck.
Now, before we go into the details of what happens on that day and the vendors that are going to be there, let's talk a little bit about the flu.
Sure.
Because I think you know a lot about it. What causes flu?
Okay, flu, of course, is a viral infection that we've been exposed to every year. The infection is usually spread person to person through respiratory droplets that are inhaled or from contaminated surfaces. Of course, the virus does replicate in the system, and then it's transmitted to other people. It has a seasonality to it, as we have people move indoors and we have a lot closer contact. That's where we see the majority of spread.
So the flu season, Jason, I know it's not fair to say what week to what week, but is it a fall seasonal element primarily or not?
Okay, so it does vary year to year. It primarily starts to ramp up in fall, beginning in, sometimes we have earlier onset in September. However, it usually doesn't peak until December through February would be the peak of flu. As in previous years, we've had some earlier peaks, like in November, December, but it typically starts out in September and tends to peak over those winter months and can really extend even into April and May.
I didn't realize the season was that long. It's a long flu season.
It usually has a more defined peak where we have the majority of cases. It tends to also favor when people get together around the holidays. So, for example, when people get together, well, you know, the virus, since we're really not contained indoors, doesn't spread as rapidly during this part of the season. But as it gets colder and people close up their homes and people move indoors, you see much more of that. So I would say that, for example, when people get together at Thanksgiving, the virus is already starting to spread, and then everybody gets together, and that happens, and then over the Christmas holiday, and therefore that's why we have that peak around that time.
So how do I know if I have the flu? What are some of the flu symptoms one might experience?
Okay, so fever would be the most noticeable symptom. Of course, you can monitor your own temperature. People feel, chills, hot and cold, that sensation. That's pretty indicative of the flu. However, many respiratory symptoms are also involved. GI symptoms, nausea, vomiting, malaise, you just don't feel well. So those are some of the signs. Of course, you can be tested. They have, there are some over-the-counter flu tests. However, most people are tested either at their doctor's office or an urgent care clinic to evaluate whether or not they actually have the flu.
So now that we know a little bit about what the flu is and what the symptoms are, why should people bother to get vaccinated in the first place? I mean, why go out of their way to go to the senior living or to go to the Shriners Club and get themselves vaccinated? What good does it do?
Well, vaccination is our best way of preventing or minimizing the severity of the flu, especially for those people with other chronic medical conditions, those people of advanced age. So the flu does help to prevent in many cases, but it helps to minimize the severity, especially with people that are at higher risk for severe flu, which could include hospitalization. And unfortunately, people still die of the flu every year.
But I like to get this on the table because I think it's important. The flu shot is not just for elderly, although we clearly recommend it for the elderly. The flu shot is for everyone.
That's right. It's recommended for 6 months and older. We won't be vaccinating down to that age at our clinic. However, we do go down to the age of 9 with parents and guardians, and it is recommended for everybody. It's a very simple process. It's usually very well tolerated. You cannot get the flu from the flu shot, as it is a killed or inactive vaccine. It is a killed version of the virus that stimulates the immune system to produce that protection and prevents the flu itself.
From you catching it. So clearly, it's designed for everybody, and everybody should get it. But our seniors, especially, have to get this flu.
They certainly are at higher risk for complications associated with the flu, and there's even a different formulation for seniors. There is an over 65 vaccine that has a higher antigen load to produce a more robust immune response and a longer durability, because as we age, we don't, produce as robust immune response, and it doesn't last as long. So that higher dose does help protect them better.
That's the booster dose for us old people.
That's right. Yep.
How should I ask for that specifically when I go get my flu shot, or do I fill out a form and the pharmacist administering it will know?
You should ask for it. It is recommended by the CDC that you receive a form of the flu vaccine. However, that over 65 vaccine offers a higher level of protection. And so I would specifically ask for it. The one we use happens to be the high dose flu vaccine, but there's another one that has an adjuvant or an added ingredient to improve the immune response for over 65. So there's 2 different mechanisms to improve that. I would ask for some people call it the senior dose, if you will, since that it's not administered outside of those guidelines.
Is there any person that should not get vaccinated?
The only contraindication to a flu shot is a severe reaction to a previous dose. There are egg-free formulations for people that have an egg allergy, so they can still get the flu vaccine and not run into that complication, although the risk is fairly small in that case. But unless you've had a reaction to a previous dose of the vaccine, you should get it.
Well, now that we know all about the flu, now that we know about the symptoms, I know you're working very hard on the flu clinic. So tell us a little bit about it.
Okay, so we've had this annual vaccination clinic that we host for the community to give them access, especially early in the year, since many people want to get their flu shot done and over with before they have to concern themselves about moving indoors. It's not too soon to get the vaccine. Some people like to hold off until later in the year. I would certainly recommend having the vaccine before Halloween. However, we recommend getting vaccinated as soon as the vaccine's available. September is a good time to do that. We have hosted this for many years. It's open to all ages down to the age of 9. At the corner of 38th and Zuck Road, at the Zemzem Shrine Club.
Zemzem Shrine.
Yep.
And what are the hours that it would run?
We have 8 a.m. to 5 p.m. So we'll be there all day long. So if you want to come get it before work, come get it. If you can get out in time before the end of your day, we'll be there till 5 o'clock. We'll be vaccinating all day.
Tell me, when somebody goes to the flu clinic, what's there? I mean, it's just like I fill out a form. Well, what happens when I walk in the door?
The process of getting vaccinated is fairly straightforward. We have people bring their insurance card, and we like them to have ID, just because a handwritten consent form, sometimes legibility can be an issue there, but they would just fill out a consent form, sit down at a registration table where somebody enters that information into the computer system, and then they move on to the vaccination station where they receive their vaccine. They're welcome to stay after their vaccine if they'd like to, but there's no requirement to stay 15 minutes after a vaccine, where there is with some. But we're also including a lot of vendors, community vendors, to allow.
So there'll be tables with community vendors on. Who do you think might be there?
That's correct. Well, we have some of our LECOM community vendors that are going to be there, but we also have some outside vendors. I have a list of them here. We, of course, are inviting GCAC, which is going to be there. We have CRI, Community Resources for Independence. That's more of a senior organization. We're going to have some insurance brokers there, Vickery Insurance, to guide people that need Medicare-related information or guidance. We're going to have Meals on Wheels. LECOM's been involved in Meals on Wheels for some time. Well, they'll have a representative there. Hopefully they can make more information available to the community on how it is employed. We're going to have Vantage durable medical equipment there to represent the DME sector. The Mill Creek Township supervisors wanted to come and meet up with the community. We have the Companion Animal Coalition, as there's many service animals nowadays that are used to help comfort people in situations such as that, and even an elderly companion, as the name would, gives them somebody to spend their time with. And then there was another organization called Coalition Pathways, which is also involved in helping seniors, I guess, more from an informational standpoint.
So aside from getting a flu shot, it's really informational as well, the flu clinic, and there are a number of information tables that people could learn about pet care, they could learn about senior care, they could learn about insurance. It's sort of like one gets all when you come and get it.
Correct. You can get your flu vaccination and get a lot of information regarding these community organizations that help support the seniors and in general.
Now, I want to switch gears just a little bit and then come back so we can go through the details of the flu clinic again. COVID is back. It seems like it's beginning to perk its nasty head. Do you think we're going to have to get another COVID shot?
Yes, we are having some spikes, waves, call them what you will, where COVID is not going away.
Really?
No. And there has been a new vaccine that's been approved by the FDA and the CDC, and it's actually in the distribution phase right now. They're recommending it for all ages, 6 months and older. However, there is that select group that are at higher risk than others, which would be over 65, people with chronic medical conditions, people who live in long-term care or community situations. So the vaccine is in the distribution pipeline. I expect supplies to be readily available in mid to late September. For convenience sake, if you were to get a flu and a COVID shot, you could get those at the same time. We're not going to have that available at the Zemzem Club.
This is just a flu clinic.
This is just a flu clinic and community vendor expo.
Do you think we'll be doing something with COVID vaccines down the road when they become available?
Absolutely. We have our walk-in clinic here at 3910 Shaper Avenue. We're going to have it available as distribution allows.
What would you say to those who are so fed up with getting vaccines and shots they're just going to ignore it because of vaccine malaise?
Unfortunately, we have had to have multiple doses of COVID vaccine since the beginning of the pandemic, and some people are a little burnt out, if you will, on getting the vaccine. But the vaccination process is a pretty simple one. It is covered by most insurances, and the bottom line is that the more people that get vaccinated, the less disease there is for everybody. And so that protects our at-risk population. Even though I feel like I'm young enough that I'm not in that high-risk population, I certainly still could get COVID and have severe complications, but my likelihood is much less. But by me getting vaccinated, I protect all those that I come in contact with. So the more people to get vaccinated, the less.
It's almost a communal responsibility. I mean, we know that flu spreads by people getting together in an enclosed space. We know that COVID spreads the same way. And in a sense, it's almost a communal responsibility to go get the thing, to protect those who are older, those who are younger, those who refuse to get it. By getting it, I think we protect this.
It is really, it's a public health issue, and some people feel like they're not at risk, so they're not interested in getting vaccinated, but it goes beyond the individual. It protects the community, if you will. So you have to sometimes take one for the team.
Take one for the team. And then once distribution becomes available, hypothetically, the end of September, early October, we'll be doing something up here at the LCHA for vaccine.
Absolutely. Mhm.
Well, let's wrap up again by giving us again time, place, who, what, when, where for your big flu.
Okay. So right after Labor Day, Tuesday, September the 3rd, we're going to be at the Zemzem Shrine Club at the corner of 38th and Zuck. We're going to welcome everybody to come and get their flu vaccination, come out and see the vendors. We're going to have a lot of, senior organizations there to help people on an informational basis. We're going to make a day of it. So reminder to bring your insurance card and your ID. We'll be there from 8 to 5.
This is a wonderful thing that LECOM does, and it's a wonderful thing that you do in coordinating it. I will be there. I have it marked on my calendar for Wednesday at 9:30, and it's such a simple process. I mean, you're really out, and it's not long at all, and it's not terribly painful. Mm-hmm. So thank you for what you're doing to keep our community safe.
You're welcome. We're hoping for a great turnout. We'll do our best to get people through quickly and efficiently.
And I know you will. And this is Monsignor Rubino from LECOM Health Matters. Thank you.
Thank you.